Azithromycin is something you will absolutely see during your career as a nurse. This is a very common medication. Its trade name is Zithromax. Okay, so this is given a lot both in the hospital and in outpatient settings or in places, like family practice settings. This is a medication that is prescribed very often because it's very broad spectrum. It treats URI, respiratory infections, lower respiratory infections, chronic bronchitis, otitis media, skin infections, various STIs, prevention of bacterial endocarditis, and treatment of cystic fibrosis. So it has a very broad spectrum of conditions that it can treat and that is given for. So that's why it's such a common medication and very important to know. What it does is that it inhibits bacterial protein synthesis. So if we inhibit the synthesis of protein in this bacteria, the bacteria is then obviously going to die, and we are going to then be able to treat this infection. Therapeutic class is anti-infective, and it's an atypical mycobacterium. Pharmacologic class is Macrolide. So nursing considerations, one of the biggest things to keep in mind with this type of medication is that it can lead to pseudomembranous colitis, which is inflammation of the colon caused by C. diff. Okay, so it can lead to C. diff and the pseudomembranous colitis, pain, diarrhea, nausea, Stevens-Johnson syndrome we've talked about before, which is really kind of the skin starts to kind of come off the patient and it's very severe. You'll see it. Angioedema, which would be swelling of the tissues of the face and which can actually lead to cutting off respiratory tract. So they can actually swell the tongue, it can swell the cheeks, it can swell the lips to the point that the patient is no longer able to breathe. Very serious condition. And so that'll be something you're going to want to watch for in your patient. It can also lead to increase the risk of warfarin toxicity. So if you have a patient who's taking warfarin, they get a URI, they get azithromycin added, then you're going to want to watch for toxicity, warfarin toxicity. Want to monitor for signs of anaphylaxis. And then you're going to want to let the patient know, they need to let the nurse know or the physician know that of new diarrhea, blood or pus in the stool, which could be a sign of the pseudomembranous colitis and the C. diff. And you're going to want to instruct the patient to take the medication exactly as prescribed. What'll happen a lot of times with patients, especially when this medication is given in an outpatient type setting, when they come into the doctor, they're prescribed azithromycin and they leave. What a lot of times will happen is they start to notice they're getting better, right? Well, because they're taking the medication. But what the patient will a lot of times do is they'll stop taking the medication. They figure, well, I'm getting better, so I don't need it anymore. But what you need to let them know is they need to take the entire course of the medication. These medications are prescribed specifically to treat over a specific course. A lot of times it'll be 10 days or so, but they need to complete the entire course of the medication. All right, so this is an important medication to know. It can treat a lot of things. You're going to see it often in your career as a nurse. This has been another episode of the MedMaster Podcast by Nursing.com. To get your free copy of the 140 Must-Know Meds textbook, head over to nursing.com/140meds. That's nursing.com/140meds. When you head over there, you get a free copy of this book. All you have to do is pay for shipping. We love you guys. Now go out and be your best self today. Happy nursing.